Hello and welcome. I'm Joanna Junak and this is GFN News on GFN.tv. At the start of September, 83 leading international experts in public health, nicotine addiction and tobacco control addressed an open letter to the President of the European Commission. In their message, they voiced concerns over the proposed plan to introduce new taxes on reduced-risk nicotine products such as e-cigarettes, heated tobacco, and nicotine pouches. The experts highlighted real-world examples of successful harm reduction, especially in Sweden, the United Kingdom, and New Zealand. GFN TV has contacted a few of the signatories of the letter, asking for their thoughts on what consequences might follow if the proposed plan comes into force. Let's hear what they had to say.
If new taxes are imposed on less harmful nicotine products, the resulting price increase could trigger several negative consequences, including the growth of the black market. Three things. First, a price hike on products like e-cigarettes might cause low-income smokers to revert to smoking traditional cigarettes, which are often cheaper and more accessible. This undermines harm reduction efforts, as the very goal is to move consumers away from the most damaging products. Second, the increased cost could boost the illicit market. When legal products become more expensive, an opportunity is created for the sale of illegal, unregulated alternatives. These contraband products are not subject to the same quality and safety controls, posing a significant risk to public health. And finally, this measure could reduce tax revenue in the long run, while the goal is to increase revenue. If consumers turn to the black market or switch to cheaper products, the tax increase might not generate the expected benefits and could even lead to a decrease in overall revenue.
I wish to make clear that there's overwhelming evidence that e-cigarettes are far less harmful than smoking. It was shown that the emissions of toxic substances are reduced about 100-fold as compared to tobacco smoke. And a number of clinical studies, consistently demonstrated the benefits of switching from smoking to vaping. In fact, common sense may be sufficient. It should be obvious that inhaling a vapor from a heated liquid causes less harm to the lungs than inhaling smoke from burning plant material. But it's not just about health. Cost matters too. For many smokers, the lower price of e-cigarettes is a strong motivation to finally make the switch. If the EU now imposes an excise tax on e-cigarettes, that incentive disappears. Instead of encouraging smokers to move to a safer product, it will most likely slow down the transition away from smoking. And there's another problem. Taxing e-cigarettes like tobacco sends the wrong signal. It tells the public that they are equally harmful, when in reality the science shows us the exact opposite. This misleading signal to the public will cause preventable diseases and cost lives. We need regulation that reflects the evidence, regulation that clearly distinguishes between combustible cigarettes, which kill half of their long-term users, as we know, and alternatives that are massively less risky and could save millions of lives. Policymakers should not punish safe alternatives, but support them as a pathway out of smoking.
Okay, so I'm against taxation of vaping products at all, on two counts. One is I don't think there is a rationale to tax an intervention that is designed to help people get away from deadly smoking. So that's the first thing. I go a step further. Not only would I not tax it, I would have the government subsidise a little bit like NHS Leicester, where they're in the UK, where they were giving out free vaping equipment to people who are trying to quit. Excellent service they were providing. That's the first thing. The other thing I would say is if you look at the, I can't remember just recall the exact detail of the taxation that is being proposed, but of what I've read, it seems to be comparable to the taxation to smoking, right? So that has another knock-on effect in that it gives consumers the impression that the harms of smoking and the harms of electronic cigarettes are comparable. And we know that that is absolutely not the case. We know all the harms of smoking, and there are very, very little in the way of harms, hardly any harms actually, related to vaping. So that will also dent consumer confidence and also the public. It'll tie into the idea of this anti-vaping narrative that you've seen over the last few days, I'm sure, in the UK with news headlines about vaping epidemics. This kind of speaks to that idea that this must be a very harmful endeavor or activity because the tax is so high, or the proposed taxes are so high. So that's my kind of opinion regarding this. I'm sure there are others with who can flesh this out, but I think they're the two big things for me.
Well, we are talking, I mean, all our information indicates that we're talking about literally a tax raid on harm reduction products. Let alone that the money are not going to be used for healthcare purposes to treat smokers or to improve healthcare services to smokers. They're going to be used for the rearmament of Europe. So that's one ethical issue. The other very serious issue is that the European Commission wants to tax a product which is a solution to the smoking problem in Europe. And Europe still has a huge smoking problem. Almost a quarter of the European adult population is still smoking. And in some countries, it's even worse than that, of course. Tobacco harm reduction and all these products have been proven to be a solution, and all countries that have managed successfully to address their smoking public health problem, they have done it with the use of tobacco harm reduction. Take a look at Sweden, the only smoke-free country in Europe. They managed to do it only with the help of THR. Look at the UK, another European and former EU member state. They have experienced a strong reduction in smoking rates because of harm reduction products, mainly electronic cigarettes, but not only electronic cigarettes. So it's quite a paradox, and it's of course scientifically unjustified to punish a solution to the smoking problem. The smoking problem already costs a lot of money to the European Union in terms of healthcare costs, in terms of loss of productivity, reduced quality of life, and of course premature mortality. So instead of incentivizing smokers to use harm reduction products, they are going to basically discourage them from doing that. Because as you know, and as everyone knows, a price is one of the strongest incentives to convince smokers to use an alternative product. And without the price incentive and the competitive price difference between these products and smoking, there will be no reason for a smoker to make a switch. Unfortunately, such proposals are also accompanied by totally unscientific arguments made by European Union officials in social media. Very recently, the Commissioner for Health of the European Commission released two tweets, which were accompanied, of course, by readers' context because they were very inaccurate, saying that the risk of harm reduction products are comparable to combustible cigarettes, which I don't remember in the last several years hearing anyone, even the strongest opponent of harm reduction, suggesting that these products are of comparable harm to cigarettes. So you understand that these are totally inaccurate statements. They could, I mean, someone could even classify them as misinformation, not only misinformation, but disinformation in reality, because I cannot imagine that the DG Sante does not know things about this. And if you don't know, and if you lack knowledge about the subject, you're not making public statements about it. You first get informed and then you make public statements. So I think that these tweets were a part of the political decision and the political move to heavily tax these products. Everyone understands what's going to happen. Use of these products is going to be reduced, and that means fewer smokers using these products to quit smoking. Even former smokers relapsing back to smoking. We may see even this reality, because it's not only the price that is going to create a counter incentive, but also it delivers a communication message that these are the same as cigarettes. So why would anyone take the hassle to make any sort of change in their habits? And you know that harm reduction product users are quite sensitive on health-related issues, and they can very easily be intimidated into thinking that these products carry some known or even unknown secret harms. And I've witnessed also myself the reaction in such cases being throwing away harm reduction products and go and buying cigarettes. Unfortunately, this is what's happening with the majority of smokers or former smokers. So we need to be very careful. And of course, the European Union has a commitment for all policies to be driven by evidence. So we cannot accept such policies or policy proposals which go against the best available evidence that we have right now. And it also goes against the best example and paradigm of countries that we have right now. I haven't seen any successful country in handling the smoking epidemic which has banned these products. And it's very simple. These products are a necessary supplement to all other tobacco control measures. Of course, harm reduction as a strategy, as a policy, as a philosophy does not exclude all other tobacco control measures, but it is a necessary supplement. Without it, nothing's going to happen. There is no single case of a country which has eliminated smoking without the help of harm reduction. And we need to understand that. You know, the EU has set a goal to become smoke-free by 2040. Sweden has achieved that by 2025, so 15 years earlier. And over the last several years, they're very close to the 5% limit, which is the classification limit for a country to be considered as smoke-free. But the European Union is not getting the message. They're not understanding what's the difference between Sweden and the rest of the European Union. So I think it's, and not only for the European Union, you know, but since the European Union has a prestige, it's going to be a very bad paradigm for many other countries, particularly low and middle income countries. In other regions, close to the EU, in close proximity or even further away, for example, North Africa, even Asia, it's going to create a very bad precedent, considering also that it's not a science-driven precedent.